Good day. I am Professor Dr. B.K.C. Mohan Prasad, Chairman, Mohan's Medicity Hospital, Madurai. Today, the topic of the day is personalized treatment in cancer management. Lot of changes for the past many years. What is personalized treatment? Even an advanced disease, they can definitely achieve a cure. Good day, everybody. The treatment of cancer involves many modalities like surgery, radiation, chemotherapy, endocrine therapy, targeted therapy, etc., etc. And the treatment of cancer has got lot of changes for the past many years. If you take some 30-40 years before, the treatment of cancer was only surgery alone. Then came radiation, then came chemotherapy, then came endocrine therapy, etc. And all these therapies were given to a patient either before surgery or after surgery, like that. So the treatment of cancer became multimodality treatment from surgical treatment alone few years before. To take an example, suppose if you take a stomach cancer patient or a breast cancer patient of the same age group, suppose for 35-year-old person, same status, no comorbidity like diabetes or hypertension, same stage of the disease, they were given uniform treatment. They were given uniform treatment means suppose the patient is to undergo surgery, radiation, chemotherapy, means all of them were given. This was treatment given. Only slight modification was done depending upon the body weight and the surface area, etc. That's all. But for breast cancer, stage 2 disease in a 35-year-old lady, same treatment. A stomach cancer, a 40-year-old man without any comorbidity, same stage, same treatment. Like that was given. But now people are talking about personalized treatment. So today the topic is I am going to discuss about personalized treatment. What is personalized treatment? Personalized treatment means offering a disease treatment to that particular patient depending upon the various information we get from the various tests done. For example, to take a breast cancer patient, previously a patient who was suffering breast cancer were treated with surgery, chemotherapy, radiotherapy, all these things. Now, apart from establishing the diagnosis that breast cancer, we have gone into the further evaluation of the patient's disease in the form of molecular oncology, that is using immunohistochemistry. For example, yes, breast cancer, okay. What is a type of breast cancer? On that breast cancer, what is the genomic expression? How the genes behave? What are the modifications? What are the alterations in the gene that has occurred in that patient? So depending upon that, we give treatment. What is that treatment? So we target the receptors present in the gene, so we include the targeted therapy. And the very important, the cells in the body grow because the policemen in the body, that is lymphocytes, become inactive in the body. So we give immunotherapy to activate our own immune system, that is to activate our own lymphocyte, that is our own body policeman to fight the cancer cells. That is a modern development. What the advantage? Why should we have this treatment? See what happens when we give a treatment like surgery, radiotherapy, chemotherapy, everything to a patient suffering from a breast cancer, stomach cancer. Some patients may be over-treated and they have to undergo the toxicities of the radiotherapy, toxicity of the chemotherapy. That may be an over-treatment and they have to undergo all this toxicity. But we don't know which patient requires that therapy and which patient does not require therapy. We don't know. That is why we are given all the modalities to all patients without taking any risk, because we want only complete cure to the patient. At the same time, they were suffering from side effects like the toxicity of chemotherapy and radiotherapy. What is personalized treatment? Personalized treatment, depending upon the further analysis of the genes, we give only necessary treatment. For example, a patient may undergo surgery, the patient may not require radiotherapy, the patient may not require chemotherapy. The patient may require a targeted therapy or immunotherapy. By this, what happens? We avoid unnecessary treatment. We avoid over treatment. Thereby, we avoid the complication of the over treatment or the unnecessary treatment. That is the personalized treatment. What is the disadvantage of this personalized treatment? Personalized treatment is quite expensive because all these newer drugs, immunotherapeutic drugs, the targeted therapeutic agents are all newer drugs. So are very expensive today. Even they are not covered by the insurance companies. So the patient has to spend a lot for having immunotherapy and all these things. But they can definitely achieve a cure and they will not have suffer from side effects. Even an advanced disease where we can give you a lifespan of few years, now with this personalized treatment, we can improve the lifespan to many years because we target the damage occurred in the gene. Thereby, we attack only the cancer cells, the cancer genome, the cancer chromosome, and without bothering the other organs and without affecting the nearby organs and nearby cells. So this is advantage, and this is what is called as a personalized treatment, and it is going to be the treatment of the day as well as in the future. Thank you.